Good morning, good afternoon, good evening. Thank you for joining us today for what was going to be a very informative and exciting grand rounds about digital health and AI in Africa. I am Abigail Greenleaf, and I am a technical specialist at ICAP and an assistant professor at the Mailman School of Public Health at Columbia. So I'm really excited to be introducing our two presenters today and really looking forward to hearing from them, as I imagine you all are as well. As we usually do for grand rounds, we'll have a presentation followed by Q&A. And you can, of course, put your questions in the Q&A chat box. So let me go ahead and introduce our presenters. I'm going to start with Huguette Diakabana, who is a global health and digital transformation practitioner focused on connecting people to quality healthcare and life-saving technologies. She has deployed technology-based solutions in multiple sectors, including education and global health, in over 30 African, Latin American, and Caribbean countries. She is the outgoing co-chair of the WHO's Digital Health Technical Advisory Group, and she currently works with organizations and governments in implementing impactful technology and AI-based solutions and leveraging data to expand and enhance the quality of health services. She is a senior fellow at the Aspen Institute's New Voices program and a faculty member of Harvard Medical School's Digital Transformation and Healthcare Executive Programs. Thanks for joining us today, Huguette. I'd now like to introduce Rooks Ako, who is an independent consultant and co-founder of the Africa Foundation for Peace and Security, a think tank based in South Africa. He has held roles in academia and policy institutions, including the African Union Commission, where he served as a senior analyst with the Political Affairs, Peace, and Security Department, coordinating the Youth for Peace Africa program. He has also worked as a senior analyst in the Conflict Prevention and Early Warning Division within the Peace and Security Department. Between 2002 and 2015, he held tenure positions in the law schools of Obafemi Awolowo University in Ile-Ife, Nigeria, and University of Hull, United Kingdom. I'll now turn it over to Rooks and Huguette for their talk, and thanks again for joining us today.
Hello, everyone. Thank you, Ava, for the introduction. It's good to be here. And I think to be helpful due to possible connectivity issues, we'll go off camera. But it's good to see you all. I'm Huguette Diakabana.
Huguette, I think you're muted. Oh, there you go.
I'm joined here by Dr. Rooks Ako. You heard from the introduction, I'm very much a global health and technology person. However, my colleague is not. So I want you to hear a little bit more about him, the things that he would like to make sure that our audience knows. And then we'll talk about why the two of us are here. We can go to the next slide, please.
Thank you so much, Huguette, and thank you, colleagues, participants, for sparing time to join us on this talk. Very, very quickly, my name is Rooks, as I was introduced, and I've held tenured positions in the academia and then moved into the policy space, where for the African Union Commission, I coordinated the Youth for Peace Africa program, which is the African Union's attempt to mainstream young people into its peace and security agenda. In the course of doing that, I've worked with young people across the entire continent, as a matter of fact. Just listening to them, hearing what they do, what they need, and developing responsive policies to address some of those things, as well as building partnerships with other multilateral institutions, as well as development partners, local networks, to help bridge the gap between where these young folks are at and where really they feel they can make the best impact to society in different fields. Huguette, like she said, is more of an expert in, the sort of tech AI bit. So Huguette, over to you to take this on.
Yeah, so why we're having this talk and then why we're collaborating together, my experience has been in overseeing development of tools all the way to deploying them. And then in recent years, working closely with ministries of health and ICTs and then external partners to develop policies. One, to make sure that whatever we did correctly is sustained. And then to ensure that anything that's being brought in has follow some type of a framework. And in that work, one thing I noticed very clearly was that ministries of health are not working alone. They're a piece of a puzzle that fits into a government ecosystem. And so I noticed in whether it was a surveillance project, community-based surveillance work, where we had to work closely with ministries of telecommunications, ministries of rural development to ensure that we were aware of various challenges that population members were facing. So I started to pay close attention to who else is working in these spaces with the same population that we're looking to extend quality health care to, and what have they noticed that we might have missed in the health sector, and include their knowledge and their observations in as part of what we considered when developing digital solutions. So in one of those efforts, I attended meetings around climate to talk about the use of technology in health and how it could be useful to those in the areas. Being part of the continent where many of our countries are facing peace and security issues, I have attended peace and security meetings and this is where I met Brooks, and also in thinking about the future of the continent, who should we ensure is ready to really take the development of technology and its use in health forward. And of course, the population that Brooks works with it is just it. So we decided to come together and see what we can do. Brooks, I'll let you come in and talk about what our collaboration looks like a bit more.
Thank you, Iget. So what we've talked about extensively is how on the African continent there's a huge youth demographic and it's still growing, and how despite this obvious fact, for several reasons, some to the dearth in infrastructure development, some relating to the lack of speed of the educational system to catch up with contemporary issues, of course AI being the one we're talking about today. If you scan the continent, there's the Google AI Center in Accra, there's a master's degree in machine intelligence in Rwanda, there's a master's degree in data science in the Institut National Polytechnique in Côte d'Ivoire. These are, perhaps three of the very, very few institutions that are providing formal spaces for young people to engage with, AI as it evolves. And one of the things that we spoke about extensively was how we can collaborate, using our comparative advantages to leverage partnerships we've developed and opportunities such as these, to begin to have a new way of thinking about the future, in fact, the present and future of AI in Africa. And one of the first things we're thinking is how we can begin to collaborate with others to develop a community of practice that brings young people from different fields, those in data sciences, law, social sciences, food and agriculture, to begin to think about AI differently. I think on the continent, a lot of thought is, AI is, really ChatGPT, and, how, at least for the student population, how, they can use this to perhaps get better grades. But there's so much more that AI can be useful for, and how it can be, in a sense, contextualized to different communities to address their priorities. And so this is, if you like, a synopsis of the conversations that we've been having, and we'll be, referring to as we get along. Back to you, Iget.
Yeah, so in before and then during this conversation and exchanges with ministries of health, again, we've noted that there is the future, we're not going to reach the full potential of the use of technology in health if we really don't start thinking about who the owners of this space need to be. And so yes, this collaboration with Brooks and zooming in on the youth population and what they require in order to carry forward what all the foundation that we've built is what we'd like to talk to you about, as Ruth said. So we can go to the next slide, please. And so just a little overview, I think this community, much of this will not be a surprise to you, as you're mostly practitioners in this space, but I thought it'd be good to get us all on the same page. So I believe that all of that, depending on the source, I mean, there have been thousands of digital solutions deployed all around Africa, anywhere from surveillance tools to chatbots, to sort of training, capacity building tools for community health workers. One thing that I've always been really excited about is the use of geographic information systems and how that's helped with micro planning, with resource allocations all around. And we've collected extensive amounts of data, different types, for very specific disease programs, very specific reasons, but it is still a foundation that is there that the continent can build on. And so there's also been, again, not a surprise to this community, a tech revolution in the health space itself. If you're part of the digital health community, you're aware of the various call for proposals that have come up for tech entrepreneurs. But beyond that, outside of the health space, there's a lot of advances that are taking place in the private sector, and the public sector as well. And so all of that is really setting the continent up to develop and build on global advances in the way that we weren't before. I've added the fact that countries have also been preparing themselves, especially ministries of health who hold the mandate to ensure this happens, by ensuring that they've got up-to-date national health strategies. If it's not up to date, along with for Africa, the World Health Organization's Regional Office for Africa, to ensure that they're updating their national strategies, updating their policies. And those who had mentioned of AI in their strategies are looking to expand on that, ensure that it accounts for the developments now we all now know have taken place. And then Brooks spoke about African Union's work, the framework for youth, which includes the importance of the inclusion of technology. Africa CDC has given a lot of effort to digital health by bringing in an expert in that area to see how they can best support countries. We've got efforts like Smart Africa, where they're focusing specifically on health and looking at what could be what needs to be in place in order for countries to really develop their digital health ecosystem. So we have a foundation. Not all we can leverage in the way that we need to, especially when it comes to data and AI. Again, because the data that we've collected were very specific to programs. But I still think that there's a way to capture that and allow our policymakers to get a sense of the state of their population health. Next slide, please. Over to you for this research.
Thank you. Thanks, Kat. So this is Abba again, and I'm just popping in to help set the stage for what you Kat and Rooks were just talking about with, the youth population being a really important group to understand in regards to the future of digital health and AI. So I analyzed population-based HIV impact assessment surveys from 7 countries to better understand overall ownership of cell phones access, as well as demographic characteristics associated with phone ownership. And I did this among the youth, those aged 15 to 24 in 7 countries in Southern Africa. And again, as Huguette and Rooks are going to talk more about, the youth population are a great opportunity. They're driving mobile phone ownership in sub-Saharan Africa. And as seen on this picture I took, it's a little dark. I was in a car. The sign says, "Welcome to a new digital universe." And this is really what is taking place. This is a picture from Yaoundé, Cameroon. So looking to the graph, we see that ownership varies widely by country, from a high of 84% of youth in Eswatini owning a mobile phone to only 32% in Malawi. So again, quite a range of ownership. And then looking at access, we see that access is usually 20% or lower across all countries. So I think that the take home from this slide is there's quite a bit of heterogeneity in how much of the youth in each population owns a phone. So we can go to the next slide. I'll quickly share a multivariable logistic regression that I did for each country individually to estimate which sociodemographic characteristics were associated with mobile phone ownership, comparing mobile phone owners with those who did not have a phone or only had access. The blue highlight on the screen connotes that the odd ratio was statistically significant. And I hope this coloring helps a pattern emerge. And specifically, I have 4 takeaways from looking at which characteristics are associated with cell phone ownership among youth in Southern Africa. So 1, in all countries, the older age group, those aged 18 to 24, had higher odds of cell phone ownership compared to those 15 to 17. Second, also consistent across countries, was that those with a secondary education or higher had higher odds of mobile phone ownership than those with less than secondary education. So age and education were consistently associated with mobile phone ownership across countries. Third, in all countries except Eswatini, which has 86% mobile phone ownership among youth, which is quite high, higher wealth quintiles have higher odds of mobile phone ownership. So money matters with ownership. And then my 4th takeaway is that, interestingly, gender is mixed. In some countries, such as Lesotho, women had higher odds of mobile phone ownership, and they had lower odds in Malawi, Mozambique, Zambia, and no difference in ownership by gender in Zimbabwe, Eswatini, and Botswana. So I just wanted to set the stage for what mobile phone ownership among the youth in this portion of sub-Saharan Africa looks like. So handing back to you, Huguette. Thanks.
Thank you, Ava. And for this, and also for showing the banner that talks about welcome to the digitized universe, because that's very much the sentiment. And just let me know if you can hear me. I know that my microphone is not working as well. If you can't hear, please let me know. This slide is just, it's really a reminder. I talked about, so Ava has shared with us who's utilizing mobile devices, and those for, I think, over a decade have been the primary mechanism to deliver digital health solutions all around the continent. And so we're seeing the youth population, and as you said, Ava, in terms of gender, it really does vary in different countries. So it's not as clear cut as previous generations, where one gender is using mobile phones more than others. Moving on to this slide, just in terms of national strategies that I mentioned, I wanted to bring everyone's attention to AI, and in the same way other digital tools, the evolution happened, is that the development happens a lot for English-speaking countries. And when working on the continent, just a reminder, there are these, in addition to the numerous local languages, we've got these 4 major languages. And so what has been happening around the overview is that, continuing on with the overview, is that the solutions are developed for Anglophone countries and then adapted to Francophone, Lusophone, if they're fortunate, and then Arabic countries. So what we would love to see for the future would be to have leverage the networks that are there in these countries and look into developing solutions and specifically for those contexts. Over the past year, we conducted research with WHO in just to check in on the countries and see where they are in terms of their digital strategies, operationalizing it, and the ability to expand it to include AI as a possible solution. And of course, there were more Anglophone countries with up-to-date strategies and mention of artificial intelligence, even those who developed their strategies around before 2010. And have updated their strategies. There are fewer Francophone countries. The usual suspects, Senegal and Cote d'Ivoire and DRC, had some mention of machine learning, especially around data analysis. And then even fewer in Lusophone countries, even though there are uses of chatbots and et cetera in those countries as well. And Arabic countries have advanced they fit under either Anglophone or Francophone in our research, but they've advanced quite rapidly with their national strategies and have taken into account the various innovations that have come in over the past 5 years or so. Rooks, I don't know if you have anything to say around the languages and the importance of considering that as we develop solutions for the continent.
No, I mean, absolutely. I think one of the biggest things that, young people, meeting them in their spaces, talking to them, are always sort of highlighting is the fact that, youth is not homogeneous. And when you dissect, that concept of youth, you're looking obviously at gender dimensions, you're looking at, as Abba's slide has shown us, access to not just the technology, but access to information as well, which is obviously underpinned by whether or not, you own a digital piece, be it a phone, a computer, or a smart TV as well. But just to underline the part of the language you talk about is, if you really reflect on the statistics on the level of education in Africa, that is those that can speak like proper English or proper French, which is not, if you like, already embedded with the local languages, then you're looking at a huge population that wouldn't have access in terms of understanding, the rudimentaries of, AI and how it can be used or how it is being used. So, a really critical element here in terms of engaging young people in AI would be to figure out how meeting them in their spaces and also communicating with them in a way that they can understand it and are able to then sort of process that information in a way they are most comfortable with, and figure out how to then bridge the language difference. I don't think it's a barrier here. I mean, I think it's just a difference. And so you have to bridge that to ensure that the ideas that are coming out, the solutions that are coming from, that demographic are not limited to sort of those in the urban spaces who have gone through formal education, and are probably not, very much in tune with the challenges at the community level. And giving an example, it's like talking about maybe maternal health, or, in a community space. What would say 25-year-old educated male living in an urban area know other than perhaps research? For these things to really touch the core, I think it will be important for it to, really connect with those who are having those lived experiences, who are being impacted, by the issues we're seeking solutions to. So this really is the importance when we talk about, the language, and also referring to other slides on, sort of looking at the access to digital tools that are also necessary to sort of engage with AI and those in the field of research in that area. Back to you.
Thank you, Brooks. So yeah, just bring up, I mean, if one of the selling points of digital solutions, aside from precision, being more precise in our provision of health services, it's the expanding access to services. And as Brooks mentioned, there is just no way of ensuring that access is really that there's more access to health services if the languages aren't accounted for in the development of solutions. This is a challenge that I know as a community we've been addressing for a long time, and in many ways, I'm aware of solutions from surveillance tools to capacity building tools where we've translated in various versions of local Arabic, for example, and working in the Sahel region. We've translated in local French, and we try to break it down in sort of spoken Portuguese when working in Lusophone countries. I know it's something that we think about, but more and more, if we're really thinking of ensuring that the digital solutions aren't limited to the few, the educated, and therefore, in some way, health services aren't limited to the few and the educated. Taking it into account, the language issue is also critical. Next slide, please. These are just some of what we've noticed around what, when we're discussing AI, either with external partners or with communities on the continent. Just an anecdote, I'm part of a AI in Africa sort of working group, informal. We said we'll meet together. It's people from different sectors. Fewer people from health are joining. I think we're in the health space. We can do give a bit more effort into joining these groups. And we were talking about the fact that we haven't actually just sat down to think about what do we actually need and what do we know about these technologies and how can we develop them to respond to our solutions, because we've focused on adapting what's already available. And sort of, and in some ways we can, and in other ways it's not as possible. But what's happened is that we've adapted. We've worked on, for example, there's been extensive progress around community health tools. I know a few lived in Burkina Faso, and there is one that's now used in a collaboration between a Swiss NGO, two different universities, maybe even more, that's scaled countrywide, with various components focusing on children 0 to 5, and the Ministry of Health continues to build on that. So there's been a lot of progress in that area. There's been a lot, of course, around data analysis to some extent, and a lot of discussion on how to increase the use of AI solutions around data. But again, I mentioned we're still dealing with fragmentation and data quality, especially in the public health space. Around population health communicating during the pandemic, we saw efforts in that area where governments were able to connect populations to chatbots for advice. Various solutions are being used to secure appointments, send reminders to parents for immunization. So there's been a lot of that happening. But what we're talking about is really how do we how do we think about our problems without sort of the external framework that have been established, and then try to see if there's anything unique and fit for purpose that needs to be developed for the continent, and collaborate with partners outside to ensure that if we don't have the capacity ourselves, to ensure that it's developed and we can help manage it. Rooks, I would love to hear. I know that you're interacting a lot with policymakers, with entire parliaments around the continent. I'd love to hear sort of what you're hearing around AI and their perceptions and what's and their expectations.
Thanks so much, Iget. And what I will do is address that, as well as, attend to one or two questions that have popped up in the chat box. And, thanks so much for the questions. Young people, talking to them, are not so familiar with AI in terms of what it is and what they can do with it. I think when you talk about AI, the first thing they say is, oh, ChatGPT, and even though I don't know, I'm not an expert by any stretch of it, I know that is just one of, several AI tools that are useful. But let me also echo what you just mentioned, that it's not so much about what's out there and how can those tools then be translated to languages that young people on the continent can then benefit from. I think what we're talking about here is more about how can these young people be introduced to interact with the essence of AI and begin to think about how they can use, for example, data to drive, solutions to issues that they face in their communities. How can they think about, configuring existing tools to serve them, and I think it's also important to then sort of refer this to one of the questions, that is asking about, the private sector interest and how that sort of keys into this. Now, the private sector are somewhat interested, and I think for them it's a bit of treading carefully, because one of the few things that I think on the continent is worrisome, and perhaps globally, is the perhaps lack of that big framework that sort of regulates, guides sort of what goes on in that AI sector. I remember still being with the African Union and working and having several conversations with Meta, for example, on how it's important to sort of do capacity building to young people to understand how bots work, how the issue of hate speech, for example, and make them understand the role of these technology companies and how they take that data and use them to, in a sense, determine what fits into hate speech and otherwise. And we tried to do a training that sort of brought the nexus between human rights, that's the right to free speech, the right to association, but also sort of highlighting the elements of hate speech that comes into this. So there are a few that are interested. There's also Google's AI Center in Accra, which is more of a sort of more hands-on technical training type thing. But Iget and I, for example, we're having a conversation with a partner in Europe that we're hoping we can convince to bring the experience in data gathering and it's using AI solution development, and to sort of have them engage in some form of consistent or sustainable capacity building to help young people be comfortable with the idea of in a sense, toying around with AI to figure out what solutions, they can bring. So to say in a nutshell, yes, there are a few of these investments from the private sector. It's nowhere near enough, as a matter of fact. Foundations such as the AFPS, which I co-founded, is extremely big on citizens' engagement, and of course, the youth for us is the primary target, and so there are very few that are youth centric. And maybe an example to give would be in Cameroon, for example. I know of an organization that I work with and they're trying to do a competition just to raise awareness amongst young people as to the different facets there are to AI. So so this is sort of my reflections around what the young people can be doing, and the role of, if you like, the big tech and smaller tech companies, as well as the foundations. It gets back to you.
Thank you, Roxanne, for also addressing the questions around private sector involvement. I wanted to speak to the question around training. So there are often the trend has continued where implementers are trained on very specific areas that are needed in order to complete a project. And of course, I understand it makes sense. It's not a criticism, but I also know of efforts where universities are collaborating with external universities. So I know of a colleague here I'm based in Switzerland at the moment, and a colleague who works with an organization focused on AI in health, on the policy side, also a professor, and has really is from Algeria, and has really made it a point to connect with student groups around the continent who are interested in AI, to provide foundational understandings, to allow them to be able to really fully understand the potential for AI on the continent. And so there are sort of ad hoc and individual efforts that I find are a bit more advanced and organized than sort of formal training efforts that are providing foundational learning. And then in terms of digital health groups, I'm happy to, if the person who had the question connects with me on LinkedIn, I'm happy to share more detail if you let me know what regions, because they're by region and by language. I'm more connected to the Francophone groups, but also know about, there are the known ones, but there are also smaller ones that aren't necessarily known. We can go to the next slide. I know we only have about 10 minutes left. Thank you, Abba, for letting us know. We've been talking on and off about the challenges that we have. I'll speak to the infrastructure and connectivity I talked about, and then I'll let you come in to speak about the regulatory environment and then the resource area. And so this is not new. And what I continue to emphasize this point, because we're still facing as a continent infrastructure issues, especially around power, and then connectivity. Abba's research was very encouraging to see the level of use of mobile devices. So that means we're going in the right direction as a continent. But also, it's not lost on me that the majority of our continent reside in semi-urban or rural areas. And there is still a need to extend, if we want to extend health services, there's still a need to extend power, roads, connectivity to those areas. What we can do remotely is still limited. There is a time where people need to get to a facility. And so that continues to be a challenge, but I know that ITU, for example, and WHO have are collaborating closely to equip ministries of health and ICTs on how they can collaborate and leverage the telecom access that ITU has to address the connectivity issue. But the infrastructure one is, as a community, we can't serve it alone. So when we're talking about private sector investment or partnerships, the infrastructure issue is one that we cannot ignore if we're going to really maximize, amplify, the potential that's available to us with technology and AI. Brooks, I'll let you jump in as well.
Thank you so much. And yes, there's a comment regarding, the trends on, and yes, it's true. Access is growing in Africa. And I think that one of the points that we're really trying to put through here is we really shouldn't be sitting back and watching that access grow without really leveraging it on it. So if 10 more people are owning mobile telephones, for example, imagine those 10 people already having an idea of AI and what it can do, and that puts them in a better position not only to use those mobile phones, but also to begin to think about how the challenges they face in health and other sectors can be addressed and solved by AI and the devices they hold. But just very quickly is to then say, what are the resource constraints? Young people, even when they have organizations, are not equipped with the institutional frameworks that enable them, get partnerships, funding from, if you like, the bigger INGOs, development partners that they can leverage to really do a lot. So what you will find mostly would be, sort of hackathons and so on and so forth, where, the winners are given some, cash prize or a fellowship, that enables one person, advance their knowledge. So we're really looking to a situation where through the work we do, we can have, these resources available to these young people that require them. And in terms of the regulatory environment, it's not so much about the existing laws per se, but how these regulations are made. And I think what we all can attest to is, give a 3-year-old kid a mobile telephone and you'll be amazed that, they can really work their way into Google, not Google now, sorry, YouTube for kids, and they can go onto their favorite shows and they can, mute it, go, all the things that go with that. But on the continent, who's making these laws? It's the grandparents, not even the parents of these young kids, who are not necessarily in tune with what the real challenges around, contemporary issues, and in this case, AI, really are, So I think it's really important that, we also begin to see how we can empower through knowledge the young folks today, give them that experience in sort of both the private and public sector, so that we're enabling them understand how policies and other regulatory frameworks should be responding and catering to niche areas such as AI, so that as we go along, we're then able to have folks who are well aware of the needs and can really address them. And I'll give you a really basic example. Earlier this week in Nigeria, the minister for the interior minister announced that Nigerians could sit behind their computers starting from next month and fill out the applications for passports, upload their pictures, and then just go into an office, thumbprint, and get their passports done. As simple as that sounds, I mean, in 2023, that should be the norm. But it took a 40-year-old minister in 2 months to come up with that, and he's been applauded. I mean, to me, it's basic. But this is an example, a practical example of what I'm talking about. I out of interest, I want to, sort of look at the age range of the minister since independence and see, what this really is about. But for me, I think on the face of it, it just shows a youthful person can come up with ideas, not necessarily out of this world, but just basic ideas and figure out how they can work. And this is what we really want to do and promote. Iget, back to you.
Thank you. We can go to the opportunity slide, which we've spoken to as we were covering the challenges. And then maybe we go to the last slide before the Q&A, just so we can speak to some areas that I think we've spoken to before, just emphasize some of what we want to say. So we can go to the next slide again, please. So in terms of, there's a question here around if youth are thinking about, can Africa use AI beyond Northern approach? We, at least the groups that I'm a part of, and I'm not youth, but most of the members are youth, part of the members of the youth population and the people that through Rook's his work. It's certainly a question. I think we are at a phase where we're awakening to the fact that we can think about uses beyond Northern approach. For the digital health phase, it took a bit longer to get there, right? Because solutions were developed. I worked on solutions where we developed it in Nigerian developers, Guinean developers, Congolese developers, collaborating with developers in Germany from all over Europe to develop solutions. And you saw how the understanding of context played into the way we developed the solutions, and then the acceptance by Ministry of Health officials. And so I know that there is something about, when it's being developed for the continent by those who are on the continent living and dealing with the issues firsthand. And so these are the types of discussions we're having. And even though it is about our continent by those of us who are from the continent, we definitely welcome partners from outside joining in and maybe challenging us in ways that we might not happen if we're alone. But this is certainly something we're thinking about, especially those of us who have formed these groups just on our own. So I'm definitely encouraging anyone who is wanting to keep up with what's happening with the AI space, within the AI space in the health sector, the opportunities. How are people around the continent thinking about it? How are they seeing it to be its value beyond sort of population level? How can it be more specialized for the needs of the continent in the way that's beneficial? The regional and local networks, like ones that Brooks and I work with, and others, are useful to plug into. And then just, of course, considering, I mentioned earlier that ministries of health are one piece of the government puzzle, governments with their own priorities, and that we sometimes, as I say we because I also work with international organizations, that we sometimes ignore, but paying attention to what is the government's priorities. So what are they trying to achieve, and how can we support that, and trusting sort of their understanding of the needs of the population a little bit more. And then rethinking partnerships. In health, we tend to stick with health. Working with Ruth has been eye-opening, because I realized that some of the issues that we're trying to address, he's also trying to address it just from the peace and security angle, and not necessarily thinking about it specifically as health. Like, who's there? What are they doing already? What do they know about the populations we want to help? What do they know about technologies that are being used in the climate space, for example, that haven't been amplified and could be useful? What can we give them that we've developed? I talked about geospatial, the GIS tools that could be so useful in other areas of the continent. How can we collaborate on that? And then just establishing true partnerships with researchers on the continent, allowing them to share with external partners their own knowledge and their ideas and their recommendations, and allowing that to shape how we then work on the continent would also be useful. I know, I don't know if we're already moving into the Q&A, but I wanted to give Brooks an opportunity to say something around here as well.
No, thanks again. But I think we've covered quite a bit. So perhaps best to turn over to Abba, and then we can take it forward, and then sort of chip in whatever personal thoughts that we have. So Abba, thank you. Back to you.
Great. Thank you. Thank you so much, Yuget and Rooks, and thank you for answering some questions throughout the presentation. So let me start with a question in the Q&A, wondering about if AI models have been considered for forecasting the supply chain management. Do you happen to be aware of any examples of this?
I have whether or not AI models have been considered for forecasting. I think more the examples I have are very small, sort of small in focusing on NCD management for by small private sector enterprises and sort of tracking pharmaceuticals supply chain in country. So the example I have would be one company in the Gambia that is providing, that's done, they have mobile vehicles equipped with tools, and they provide a subscription service for NCD management. And in addition to that, they also provide the medication required. And that has allowed them to help the country address the counterfeit medication issue. But on a large scale, the supply chain systems are still very much fragmented for the most part. But I do know where I've heard a lot of discussion around the use of AI and adapting what's being done outside of the continent, especially by private sector and large pharmaceutical companies. I know Novartis is one. It has been in this area where they're really there's an immediate need and practical tried and tested systems that could be adapted on the continent. It doesn't require sort of the infrastructure that other tools might.
Great.
And then, sorry, go ahead, please.
Let me ask another question that I'd like to hear from both of you about. One of the questions is from Erman. What are the ethical implications of AI development in Africa? Wondering if there's anything that's really top of mind for you about the ethical, how to ethically approach this in sub-Saharan Africa.
Okay, I mean, I think for me, it would be to first of all add on to Higet's answer, which is to say that yes, a few companies on the continent are, using AI. I know, but I don't know of any in the health sector. But the delivery sector is one where sort of online shopping delivery sector. Jumia, I remember reading that they were beginning to use these tools to project demand, and keeping sort of determining what stocks to keep and in what quantities, as well as to help in delivery. But coming on to the question on the issue of the ethical implications, I think this is really one of the areas where we have concerns as well, and this is why even if we haven't used those two words, ethical implications, we keep referring to young people not necessarily interacting with the technology as developed today, but also being aware of things around it. What is it about? How can it be utilized? How can they interact with them? Because it's from this sort of knowledge that then sort of multiplies that people are aware of the issues of you know, if anyone is asking for my data, you know, how can I protect that? How can I ensure that I'm not signing off, you know, my life's worth of information. You know, so how is it gathered? How is it kept? How is it used? And these were some of the trainings that we did, however, within the remit of, you know, early warning and conflict prevention, like was said earlier, more from, you know, that peace and security background. So yes, there's that on the top of the list. For us, it's a concern, and I think one of the ways to really address that issue is not simply to give folks if you like, a tick box on what they agree in terms of information that should be taken from them, but for them to actually be aware of what information is taken, what could it be used for, amongst other things. So, and that's just as an example. Of course, it's a whole lot more than that in terms of the ethical implications. But again, I don't know if you'd like to add anything on to that.
Yeah, there is still a lot of work to be done in the health space, especially around informed consent. And as we were saying, the need, and I was really happy to hear that they actually took time to train people on that. I mean, the majority of health projects are sort of data for service projects if we're going to really water it down. And I know there's been value for the services people have provided, but the extent to which people understood how their data were going to be used. For maternal and child health, for example, there's more time taken to explain why we're taking this information, and it's to help sort of manage this process for you so you can get to a safe delivery. For immunization, for example, not sure how much parents understand when every time they come in, why is the data collected and how that's used, and how is it helping manage the country's issues. We're not quite clear. So, but those issues are, so just if we're going to utilize data collected to train AI systems, if we're going to sort of automate anything, I think there's still a need to ensure that people understand how their information is being used and how they've contributed to the quality of AI solutions. And then, of course, when it comes to, you know, countries that are still dealing with human rights issues and just, you know, the implications are quite there certainly are implications. I think what I saw in digital health before we started speaking about AI, when just developing like surveillance tools where we were collecting a lot of, you know, GIS information and microsensors, and, you know, people could identify where you are and who you are in countries where people are afraid to be known by the government, was being very mindful as partners who are offering or developing these solutions, and keeping it to what information do we actually need, and how are we in a position to really ensure people's protection, and how are we negotiating that with a government that they might fear if they're in a country where that's an issue. So those are the questions that as when I managed the development of solutions, we needed to ask ourselves, and a lot of care went into that. I would say if we're looking into AI, especially in the health space, those are certainly, there are lots of questions to ask, and if we don't have an answer to it, you know, to not just kind of brush over it, to really ensure that we get as comfortable with the idea of, okay, we're doing the right thing here. We've considered as many components as we possibly can, and that people's lives are actually being impacted by this work, especially in the health space. So I know we're wrapping up, we're at time.
Yeah, wonderful. Thank you so much, Huguette and Rooks, for joining us today and giving this important and informational talk. I think the discussion around introducing AI early and integrating it in so people fully understand it and then utilize it is really a key takeaway for me. So if we could advance to the next slide, we'll just note that tomorrow for World AIDS Day, we have a event at 9 a.m. Eastern, asking is the end of AIDS in sight. This is available to join via Zoom. And again, this presentation and slides will be posted on ICAP on icap.columbia.edu. Thanks everyone for joining and have a great rest of your day. Bye-bye.
Thank you. Bye, everyone.
Thank you very much. Bye, everyone.
Thank you. Thank you so much, Rooks and Huga. I think it's just the few of us now. Thank you so much.
Yeah.
Wonderful. Thank you so much. It was really informative, and I wish we would have had more time for questions. I love that everybody had so many good questions. It's not always like that, so it shows the audience was engaged and appreciated it. So thank you so much.
Some of the names of the questions that we didn't answer, I recognize. So I'll reach out to them, and they never asked the question, so I'll reach out to them and answer them
Great.
later. But the ones
Wonderful.
we didn't recognize.
It's hard to get, it's always hard to get to all of them, but thank you. And I wish you both safe travels, and I think you get maybe some rest for you now, and I'm sure we'll be in touch.
All right. Thanks.
Thank you
again.
for sharing your
Thank you
time.
all.
so
Take
much.
care.
Bye.
Thank you, Sarah,
Bye-bye.
for all of you for your patience with us.
Yeah.
As we read
Thanks,
the
Sarah, for organizing. Appreciate
Yeah.
it.
Thank you
All
all.
right.
Bye.
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 Thank you.